who I see around are avid walkers. I see them in the Sankey tank walking. So how many step counts, everything that's on everyone's watch. So how many step counts would you think is the best for you to kind of prevent any cardiac illness or prevent mortality? Yes? 10,000? Okay. So do we have a data on that? Yes, actually we do. So it was found in a multi-analysis trial that if you even walk 2,500 to 2,800 steps a day, that is the minimum number of steps, you can actually prevent cardiovascular mortality. So there is an incremental dose response to the number of steps you walk. So if you were to walk 7,500 steps or 8,000 steps, your mortality benefit with respect to cardiovascular disease and all-cause mortality. When we say all-cause mortality, when patients are dying either because of diabetes, hypertension or any other cause but cardiovascular cause. So your all-cause mortality also is better and cardiovascular mortality also is better or lower. So what happens, people are walking, like I've seen a lot of them walk 3 rounds of the Sankey tank and they're walking like 25,000 steps. But we do not have the data for that because it is stopped at 16,000 steps. So if you're walking around 8,000 steps per day, you're very good to go. And metabolic syndrome is something that mostly affects women. So what do we mean by metabolic syndrome? Metabolic syndrome is when there is abdominal obesity. So people tend to think that your BMI you're calculating and your optimal BMI everybody knows is 18 to 25. But abdominal obesity is what is important. So for men, if you have an abdominal obesity of more than 102 centimeters or women more than 90 centimeters, we say they are obese. So that is one factor. If there is hypertriglyceridemia, if there is hyperglycemia, if there is low HDL cholesterol, so we say all these are part of your metabolic syndrome. So what I'm trying to say is this metabolic syndrome is very common in the Asian population, in the Asian women. So obesity now, as you all know, has kind of become a pandemic. Like a lot of people across the globe tend to be obese. So if you can reduce your abdominal circumference, monitor your blood sugars, monitor your blood pressures, and look at your lipid profile, these kind of cover your cardiovascular risk factors. So if you can at least keep all these things under control, you're good to go. So I'm sure that the wellness center is kind of going to take care of all that, because then you can actually just look at the basic investigations and investigate general population also. So why it is important is because when we see that there is some imbalance in these tests, then we can risk stratify these patients. We can look at whether these patients require a basic aspirin or what we call baby aspirin or just a simple statin, because people have a closed mindset when it comes to using statins. Even a 20-year-old who has any of these criteria should be using it because it has got more pleomorphic benefits than just thinking that it's just statins. So we should not be afraid to use it. So the wellness center, I'm sure, will be able to risk stratify these patients and even get the doctors. And it's very good that they have an Ayurvedic doctor, they have So they have a nutritionist, they have an Ayurvedic doctor, and then I'm sure you have an allopathic on board. So there's an integrated approach to the whole thing, and the integrated holistic approach to well-being is very important. And just to take to what Dr. Satish Joshi was saying, that everybody has to contribute towards each other's benefit. So there is this quote which comes to my mind just while he was talking, that we tend to think, I'm only one, I'm just one person. But you are one person. And you tend to think, what can I do? But you can still do something, if not everything, so you can still do something. And you should not let something that you cannot do interfere with what you can actually do. Okay? So with this, I just hope that and wish all of you, well that your wellness clinic kicks off, and all the best to you all. Thank you.